Let's see about fibroid, which is also called as leiomyoma. This fibroid is one of the very important benign lesions of the uterus. Fibroid is also called as leiomyoma. Some of the important points are: it is the most common benign tumor of the uterus, and it is also the most common solid tumor in females. And the fibroid is most commonly seen in nulliparous women, and the age group which is affected is usually the reproductive age, that is 35 to 45 years. Types of leiomyoma. There are two types occurring either at the body of uterus or in the cervix. The corporeal leiomyomas, that is those occurring at the body of uterus, are further of three types. Intramural variety, which constitutes about 75% and they form the majority. The other two are subserous, which is present outside, almost 10%, and submucous, present within the cavity, about 5%. This subserous leiomyoma can be present either in the broad ligament, called as pseudo-subserous, or it could be wandering, that is called parasitic. Then the submucous leiomyoma, it is further of two types, facile and pedunculated. If it is pedunculated, it resembles a polyp. So this is a picture showing the uterine fibroids. The topmost one is the subserosal pedunculated fibroid, and the one in the muscle layer is the intramural fibroid, and the one which is inside the endometrial cavity is the submucosal sphere. Next, coming to etiology. The two main etiologies are chromosomal abnormalities like translocation in chromosomes 7 and 12, and certain growth factors like epithelial growth factor, transforming growth factor beta, and insulin-like growth factor. Now let's see the risk factors for leiomyoma. The risk factors include nulliparity, early menarche, obesity and increased body mass index, hyperestrogenic state, and family history. And then the protective factors are just opposite to these, which are multiparity, late menarche, combined OCPs, and smoking. Next are the symptoms of leiomyoma, that is the fibroid. The fibroids are usually asymptomatic in about 75% of cases. If it presents with complaints, then the patient will have abnormal uterine bleeding, which can either be menorrhagia or metrorrhagia. Menorrhagia is nothing but increased flow of periods, and metrorrhagia is nothing but intermenstrual bleeding. There can also be dysmenorrhea, that is painful menstruation, and dyspareunia, painful sexual intercourse. The other symptoms include subfertility and pressure symptoms due to compression on urinary bladder or rectum, and there can also be recurrent pregnancy loss, lower abdominal pain or pelvic pain, and abdominal enlargement. The submucosal fibroid can present as heavy menstrual bleeding along with infertility, and there will be spasmodic type of dysmenorrhea, whereas the intramural fibroid produces congested type of dysmenorrhea, and the subserosal fibroid, which is present outside, it can be pedunculated, and if it was pedunculated, then there can be torsion. Coming to the cervical fibroids, the anterior cervical fibroid shows bladder symptoms due to compression, including increased frequency of micturition. Then the posterior cervical fibroid, here there will be acute retention of urine, and there can also be constipation due to pressing on the rectum. Next, central cervical fibroid. It shows lantern on the dome of St. Paul appearance, which is nothing but there is a large sized cervix because of the cervical fibroid, and the uterus is normal in size, which appears as a small lantern on the dome. So here the lantern is the small, that is the normal sized uterus, whereas the dome is the enlarged cervix because of the fibroid. Now the complications, the most important and the common complication is fibroid degeneration, which is of many types. In this, the hyaline degeneration is the most common. The other degenerations are cystic, fatty degeneration, calcification, or red degeneration. The other complications include necrosis, sarcomatous change, anemia, hemorrhage, polycythemia, and infections which lead to peritonitis or septicemia. Coming to the investigations, the most important investigation for diagnosis, that is the investigation of choice, is the transvaginal ultrasound. The other investigations include saline infusion sonography, hysteroscopy, MRI, and uterine curettage. Then the differential diagnosis for fibroid, that is the leiomyoma. The most important physiological condition which is a differential diagnosis is full bladder. So to rule out this, we ask the women to empty her bladder before we perform per-abdominal examination so that we prevent getting full bladder. One more physiological condition is pregnancy, and the other pathological conditions which are the differential diagnosis are ovarian tumor, adenomyosis, tubo-ovarian mass, endometrial carcinoma, uterine sarcoma, and pelvic kidney. Coming to the management differs for asymptomatic and the symptomatic cases. If the person is asymptomatic, then and if the size is small, then a regular supervision would do and there is no treatment required. Whereas in certain cases, surgery is indicated, like in case of rapid increase in size, unexplained infertility is present, or when there is a pedunculated fibroid. Next is management of symptomatic cases. There can be medical management and surgical management. The medical management aims at decreasing the bleeding and the size of the fibroid. So if the fibroid is very large, before doing surgery, we can give medical therapy so that it shrinks in size, after which we can proceed with surgery. So the medical measures include giving tranexamic acid, mifepristone 5 to 10 milligrams twice daily, ulipristal, levonorgestrel coated intrauterine system, GnRH agonists and antagonists, danazol, which is an aromatase inhibitor, prostaglandin synthase inhibitors, and for pain we give mefenamic acid. These are the medical management. Coming to the surgical management, if the woman has infertility because of the fibroid and she wants to preserve uterus for future pregnancies, then for them the surgery of choice is myomectomy. That is, we excise only the fibroid and the uterus remains in place. If the woman is a family completed woman, then we proceed for hysterectomy, that is removing the uterus along with the cervix. And in other cases, the other surgeries include something like uterine artery embolization and MRG-FUS, which is magnetic resonance guided focused ultrasound. So these are the surgical modalities available for the treatment of fibroid. So these are all the most important points about fibroid, which are like must know points. Thank you.